Tendinitis. What is tendinitis? The tendon is the end part of a muscle that attaches into bone. Tendinitis, tendinitis, can occur anywhere in the body but is very prevalent in the foot. This condition can occur for any number of reasons. Usually it is due to an over-repetitive action of some kind, such as might be the case in a runner. Irritation of the tendon tends to become more prevalent as we age because our tendons lose some of their elasticity, the ability to move in response to the action that is required of the muscle. In most instances, the patient will be able to relate to a specific incident that caused the tendon pain, but many times a patient will come in complaining of pain in a certain part of the foot with no history of trauma or excessive activity. It is usually upon questioning that the patient will relate that they spent yesterday carrying boxes up and down the stairs, as an example, but they did not make the connection to the activity and subsequent pain. Other times, it may not be that obvious. Symptoms of tendinitis. Typically, a patient will present complaining of specific tenderness in a certain area of the foot. The area will be tender to touch, the area may be slightly swollen, and even possibly slightly red. Moving the foot in a certain manner to get the tendon to expand and then contract will result in pain. Generally, an X-ray should be taken to rule out any bone abnormality. The X-ray is of little value in viewing the tendon itself. Treatment of tendinitis. Treatment in my office is based on the degree of pain. Anti-inflammatory medication for 7 to 10 days. Warm soaks or compresses in an effort to increase blood flow to the area to help with the healing. Physical therapy in more severe cases. Immobilization of the foot is always indicated, and depending on the degree of pain and its location determines how much immobilization. Reduction in activity. If the affected area does not improve substantially within a reasonable period of time, an ultrasound or MRI may be indicated to rule out a tear within the tendon, or even a partial rupture at the attachment of the tendon into bone. Tendinitis versus tendinosis. When we talk about tendinopathies, pathology within tendons, it can be further broken into tendinitis, which this discussion covers, which implies an acute inflammation of the tendon. It is important to mention, the other type of tendinopathy is tendinosis, which is a chronic pain occurring in a tendon with no overt inflammation but degeneration of the tendon instead. Both conditions will yield pain, but the treatments offered in the previous paragraphs will only be effective in tendinitis because they attempt to reduce inflammation. In tendinosis, there is no inflammation, but instead the pain being caused by degeneration of the tendon, so it will not respond to the treatments indicated for more acute tendinitis. The point to take away from this is that acute tendon injuries should be treated immediately. Delaying treatment may lead to a tendinosis, and in those instances the only treatment is surgical intervention where the diseased tendon is repaired with an attempt to reintroduce the inflammatory phase. Read the complete article at www.foot-pain-explained.com/tendinitis.html